that highlights factors that increase the risk of death and disease among moms and their babies.
So a preterm birth is when a baby is born before 37 weeks. And when it comes to this issue, for the fourth year in a row, the March of Dimes report card is giving the U.S. a grade of D+. In fact, experts say the U.S. has one of the highest preterm birth rates among developed countries.
Our friend Dr. Lucky Seacon is here to break down what the numbers in this report mean. She is a double board certified reproductive endocrinologist and infertility expert, and she is also the author of the forthcoming book. It's due out in January. It's called The Lucky Egg. And she's my doctor, which I think y'all know. Dr. Lucky, good morning. Great to see you.
Thank you.
Good to have you with us. We want to pull up some stats for our viewers to see. Half of the states received a D or F grade for preterm birth rates on the 2025 March of Dimes report card. 21 of those states actually saw their rates get worse. I mean, wow. And you're thinking just like, how is this happening here in this country? What are some of the factors that increase the risk of preterm births?
It's really, truly unacceptable when you compare how we fare to other resource-rich, high-income countries, especially in light of all the research that's come out on risk factors. We know that lack of access to prenatal care is a major issue, and we've only seen that worsen, especially in some states where there are stricter laws around reproductive rights. And it's leading to situations where there are maternal health care deserts. And a staggering statistic that came out of this report was that in 2024, 16% of babies born were born to mothers that presented for prenatal care at 5 months or later.
Wow.
And when you think about prenatal care, that really should be established in the first trimester. That's when you have an opportunity to do preconception or early pregnancy testing that identifies major determinants of later complications, identifying chronic hypertension, diabetes. All of these screenings can happen much earlier. And unfortunately, a lot of people aren't going to primary care and focusing on preventative health. So for a lot of women, pregnancy is a time where they're getting much more medical oversight if they're showing up for prenatal care.
The D+ grade is bad enough, but then you just have the incredible inequality. The report card reveals Black and Indigenous women have more preterm births than other women in the U.S. This is a gap we see all the time in many medical categories. Why are we seeing it here?
Well, we have to acknowledge that there are implicit biases, and race and ethnicity should never be a risk factor for worse outcomes, but it continues to be that way. I think a lot of it is social safety nets. When you think about policies that help and are correlated with better outcomes, like paid family leave or Medicaid extension for postpartum care, reimbursement for having a doula or a support person in labor, all of those things are correlated with better outcomes, but they are not applied evenly across the states.
One of the biggest factors in this report that impacts the health outcomes of moms and babies, as you mentioned, is that prenatal health care. And I think a lot of people might not really understand how important that is or what it means. More than 16% of women received inadequate prenatal care in 2024. That means, as you mentioned, that they're not getting this care until the 5th month or later. And that went up from 2023. Why is it that that seems to be a growing problem?
Well, as I said, I think it's lack of access, but there's also a major knowledge gap. I don't think everyone understands the importance of that first prenatal visit and really catching things early so that you can actually modify risk factors. But I'll take it a step further and say, as a fertility doctor, my goal when I'm sitting across my desk from a patient isn't how am I going to get them pregnant? It's how am I going to get them to the healthiest pregnancy possible that really focuses on their health and the health of their future child. And so preconception care is a concept that we need to become more familiar with. If anyone has known risk factors, chronic medical conditions, we're having babies at older ages. There's a lot more obesity, so we're seeing more chronic health issues. And if we focus more on preconception care and optimization of our health before getting pregnant, I know that this report card grade would improve.
Let's talk about improving it. This is clearly a crisis. What are the solutions? Are we seeing those solutions?
So we need long-term changes in policy. We need to address this maternal health care desert issue, particularly in red states where there are more restrictive laws. We need temporizing measures because it takes a long time to fix some of these problems. So even, options like mobile clinics or remote monitoring, we need to find creative ways to ensure that people have access and they don't have to drive hours to get to their doctor because we need to be removing barriers, not adding them.
Absolutely. What gives you hope about the situation right now?
Conversations like this. I think we have an opportunity to raise awareness. We have the opportunity to inform women about how their bodies work, how to better track their cycle so they're recognizing when they're pregnant earlier, and just being able to provide them with solutions that are feasible and focusing on their health holistically, how to improve their lifestyle. There are tools that we can put the onus of control in the patient's hands, but we have to educate them first.
Dr. Lucky Seacon, great to see you. Thank you so much for being here this morning.
Thank you.